They are trying to silence me. They don't want you to notice because when you heal yourself, they lose a customer.
Are doctors being silenced about the keto diet? Hi, I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation online. This video is by Dr. Tony Hampton. I know Dr. Hampton. We serve on the same board of the Society of Metabolic Health Practitioners. And here at his site, in a video, they don't want you to know about this and about keto. He claims that he's being suppressed or being censored. Let's see what he has to say. Before we dive into today's video, I want to invite you to take keto nutritionist Amy Berger's free masterclass, The Secrets to Breaking Keto Fat Loss Stalls. If you're doing all the right things but stubborn weight still won't budge, then Amy's masterclass is for you. See the link in the description to sign up.
They are trying to silence me. Big Pharma, who develops drugs that manage symptoms of chronic diseases instead of helping us heal, the fast food and processed food industry that feeds us highly processed, unhealthy food that contributes to obesity and other medical conditions, leading to increased demand for medical treatments. And yes, if a health system is rewarded for sick care instead of healing, even they receive higher revenue from treating illnesses and the complications arising from poor health. Thankfully, health systems that focus on population health like mine are trying to change that. So why are they trying to silence me? Because the ketogenic diet is a threat to their bottom line. Imagine over 50 diseases: diabetes, Alzheimer's, cancer, depression, and so many more being put into remission with food alone. They don't want you to notice because when you heal yourself, they lose a customer. This video isn't just for you, it's for anyone you love who might be suffering needlessly. So watch until the end because I'm going to share a resource that lets you dive deeper into the science behind everything I'm about to say.
You know, through the years, there was evidence that the pasta industry got together to have a meeting that was going to squelch low-carb diets. This was back in the Atkins craze of 2003. And so I remember that. I printed it out. I don't know if I could track back to that since then. But I'm not aware of any drug industry meeting where, you know, the worry about keto has risen to a level that, you know, we need to squelch keto doctors, or I've never had anyone come to me and try to stop me with what I'm doing. I don't think we are anything more than a little flea on a dog. I mean, not a big group yet. So, but the idea is true that these medicines are not necessary, and we low-carb, keto, carnivore doctors take away medications from people as they're no longer needed. So we help people safely get off the medicines that the other doctors put people on, you know, without talking to you about what to eat, or maybe even telling you the wrong advice. So the idea that you don't need these medicines is real and is true. And I don't know yet that I've seen evidence that Dr. Tony is being actively suppressed, and I'm not sure we will, but the point is he could be, or maybe there is some evidence. Let's see.
And I'm not only going to reveal how keto can transform your health, I'll show you the mechanism behind a few of these diseases so you can truly understand its power. So let's get started. Let's start with one of the most common and devastating diseases. It's diabetes. From prediabetes to type 2 diabetes, keto can often put these conditions into remission. Why? Because diabetes is fundamentally a disease of carbohydrate intolerance. When you consume carbohydrates, your body converts them to glucose, causing blood sugar spikes. This forces your pancreas to release insulin, often in excess, leading to insulin resistance over time. By drastically reducing carbs and fueling your body with healthy fats, you eliminate blood sugar spikes and reduce insulin demand. This allows your cells to become insulin sensitive again. People who were injecting insulin daily have been able to stop or dramatically reduce their medications, all thanks to keto. Here's the science. When you're in ketosis, your body burns fat for fuel instead of glucose. This reduces the need for insulin, helps the pancreas heal, and lowers systemic inflammation, which is a major driver of diabetes-related complications like nerve damage and kidney disease.
Yeah, so you can reverse type 2 diabetes. In fact, that's the main impetus for starting a new organization, the American Diabetes Society. And I'm on the initial board trying to get this organization up and running. The main reason is to trumpet the news, although it's been around a long time, that you can actually reverse type 2 diabetes. And you know, I'd have to just comment that pharma is a big beast, and there are drugs now that can reverse type 2 diabetes because they target the weight. So these GLP-1s and then the ones second generations, if the doctor takes you from insulin and puts you on these other medicines, that's Ozempic, Wegovy, Saxenda, Mounjaro, Zepbound, all these other ones, you can actually transition to a medicine that gets you to lose weight and reverses diabetes as well. Even weight loss surgery can reverse type 2 diabetes, but to me that's a little drastic. That's a little harsh because you can do it with just lifestyle alone. But so there are a few papers, and from the companies that are selling the drugs that reverse the type 2 diabetes now saying that you don't need to put people on insulin, put people on my drug to reverse the diabetes. Well, what we're saying is that lifestyle can do all of this, and the diabetes is just the start. Let's listen.
Now let's tackle metabolic disorders like fatty liver, obesity, and metabolic syndrome. These conditions are all tied to excess insulin and fat accumulation in the liver. Keto addresses the root causes by reducing insulin levels and allowing your body to mobilize and burn stored fat. Take non-alcoholic fatty liver disease as an example. Studies show that within weeks of starting keto, liver fat can decrease by 50%. This is because ketosis triggers lipolysis, the breakdown of fat into usable energy. Instead of storing fat in your liver, you're burning it for fuel.
So the fatty liver, I just want to talk about just for a moment. The name is changed now to MASH or MASL, so metabolic associated steatohepatitis, meaning fatty liver. Because there are new medications out to treat this, another medication, it's getting more attention, and there's even a very sensitive measure being used in my area by doctors called a FibroScan. It's a way to detect fatty liver before you might have an elevated liver function test, AST or ALT. But the idea of detecting the fatty liver is to get people on the drugs. Well, I had a patient recently who had this FibroScan done for several years before doing a keto diet, and it showed, if anything, worsening of the fatty liver and fibrosis, the FibroScan. Well, a month or two after changing the diet, the FibroScan is back to normal. So you can fix the fatty liver, this hepatic fibrosis, by changing the diet. It doesn't have to lead toward a drug. But you know, awareness of something usually happens when there's a company selling something to treat it. So now you'll have more awareness about fatty liver, getting these FibroScans. Doctors will ask you to do that. Well, realize that medication is not the only way to go about fixing it.
Now for obesity, keto suppresses appetite-regulating hormones like ghrelin, making it easier to eat less without feeling hungry. That's why so many people report losing weight much easier when on keto. Now let's move on to the brain. Did you know that keto was originally developed as a treatment for epilepsy? It works by stabilizing neuronal activity and reducing inflammation in the brain. But that's just the beginning. Conditions like Alzheimer's, Parkinson's, and even traumatic brain injuries can benefit from a ketogenic diet. Here's why. The brain loves ketones. Unlike glucose, ketones provide a clean, efficient energy source that doesn't create harmful byproducts. In Alzheimer's disease, where the brain becomes insulin resistant and can't use glucose effectively, ketones bypass this problem and restore energy production. For Parkinson's disease, keto reduces oxidative stress and inflammation, two key factors that damage dopamine-producing neurons. And for migraines, it stabilizes blood sugar and reduces neuroinflammation, which are major triggers for headache pain. Keto also transforms reproductive health. And in this category, let's focus on PCOS, or polycystic ovarian syndrome. It's a leading cause of infertility and is driven by, you guessed it, insulin resistance. High insulin levels trigger the ovaries to overproduce androgens, leading to irregular periods, acne, and infertility. By reducing insulin, keto restores hormonal balance, improves ovulation, and boosts fertility. For men, keto improves erectile dysfunction by enhancing vascular health because high blood sugar and inflammation damages blood vessels over time, reducing blood flow. Keto reverses these effects by lowering inflammation and improving nitric oxide production, which is essential for healthy blood vessel function.
Yeah, so we're basically going through every organ system because the metabolism affects every organ system. So the inflammation reduction, the insulin reduction and improvement of insulin resistance, you'll find this as the key root causes for diseases in every organ system. And that's one reason why, as an internal medicine, obesity medicine specialist, I love doing this because I can help problems with the brain. The brain is just another internal organ, except in the medical world, it's carved out as neurology. So there are these artificial carve-outs, the heart. What organ is the best to a cardiologist? Well, the heart. Can't live without it. You can replace it. We don't have brain transplants yet. We do have liver transplants, so the GI special. Anyway, these are all internal organs that are affected, thankfully, in a favorable way. And even these diseases that often the current medical system can't fix can be fixed by a metabolism change that can happen by just changing the food. It really is pretty amazing. And I have to say, Dr. Tony is a rising star or shining star in our keto doctor world in the Chicagoland area.
Keto isn't just about weight loss. It can heal your gut too. Crohn's disease, gastroesophageal reflux disease, or GERD, irritable bowel syndrome are all linked to inflammation and gut dysbiosis, which is an imbalance of good and bad bacteria in your gut. Keto reduces inflammation, starves harmful gut bacteria by cutting out sugar and refined carbs. The GERD, the mechanism is really fascinating because carbohydrates ferment in the stomach, increasing gas and pressure that pushes acid into the esophagus. By cutting carbs, you reduce fermentation and alleviate acid reflux, which is why many people find they no longer have this problem when on keto. Let's look at mental health. Depression and anxiety are deeply tied to blood sugar regulation and inflammation. Keto stabilizes blood sugar, reducing mood swings and irritability. It also reduces inflammation in the brain, which is now understood to be a root cause of many mental health conditions.
Did you hear that? Inflammation in the brain again. And then insulin resistance in the brain causes all of those neurodegenerative diseases like Alzheimer's, Parkinson's. The problem with those diseases is that it starts decades before the symptom happens. So if you have any of these neurodegenerative or even mental health problems in your family and they occurred at older ages, you want to make changes now before you have symptoms.
For example, in bipolar disorder, ketones act as a mood stabilizer, providing the brain with a consistent energy supply and reducing fluctuations that contribute to manic and depressive episodes. For anxiety, keto increases levels of GABA, a calming neurotransmitter, while reducing glutamate, an excitatory neurotransmitter linked to stress. And who's not afraid of cancer? Cancer is perhaps the most groundbreaking area where keto shows promise. Cancer cells thrive on glucose and struggle to metabolize ketones. By cutting carbs, you deprive cancer cells of their primary fuel source, slowing tumor growth. This is particularly effective for brain cancers like glioblastomas, where standard treatments often fail. Keto also reduces inflammation and oxidative stress, which play a role in cancer progression. While it's not a standalone cure, many resources believe keto is a powerful adjunct therapy that can enhance the effectiveness of conventional treatments. Now, this is a lot to take in, but here's the bottom line. The ketogenic diet is a powerful tool for healing that threatens the profit of billion-dollar industries. They don't want you to know this because an informed, healthy population is their worst nightmare. but you don't have to take my word for it. There are two resources I will link in the video comments that will allow you to search the medical conditions you are interested in to see if keto can help. One is the Metabolic Multiplier Zotero website, and the other is the Nutrition Network website. They both contain a database of studies on the ketogenic diet, and whether or not there have been studies using ketogenic diet on your disease of concern. So share these links with anybody who's curious about keto, and maybe or not it can help their particular medical condition. This is your opportunity to take control of your health or help someone you love do the same. You never know whose life you may be able to save.
Well, another great video by Dr. Tony, and I do that in the clinic where I will search. I go to PubMed.org or PubMed.gov, excuse me. It's our National Library of Medicine database where articles are indexed in there. And if there's a disease that someone comes to me for and wonders if it might help, I'll go to PubMed.gov, type in keto or ketogenic, and then the disease that I'm interested in. And recently it actually came up with some new science, new studies that I hadn't seen. There's new studies all the time coming out now. If you just go to Google or Bing, sometimes just typing even outside a medical database, you can get access to information that's not in that indexed PubMed, National Library of Medicine database. But it was a case of a rare kind of cancer, and I typed keto and that specific cancer, and it turns out there's somebody studying that in an animal model in the US, and so I contacted that researcher and had a great discussion. It's not quite ready for prime time. There aren't clinical trials in that disease yet, but this is how things get started, where the animal model is developed, and then you see if there might be some sort of signal that it might help to do a keto diet, and then it gets studied in humans if money is available. The Metabolic Mind group, the Bazuki Foundation, is funding research in the mental health area, again thinking of the brain, the metabolic changes that happen on a keto diet that seem to be helpful for many people with mental health problems. We'll learn a lot more about that interplay and interaction as the years go on. But again, thanks to Dr. Tony Hampton in the Chicagoland area for this update with not only some new diseases that I haven't included, but also some new mechanisms about how keto diets and this kind of metabolic treatment can be so helpful for medical issues. What about prevention too? So we're learning a lot about how prevention of these problems is really where we ought to be. We want to be before these diseases happen. So if you have any of these in your family or have a concern just about health in general, I think a keto diet is on the table as just a preventive, healthy way of living. If you like, please like, subscribe, ring the notification bell, and look for new content on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out AdaptYourLifeAcademy.com.